You're listening to Therachronicles with Dr. Rosy and Dr. Krish. This health awareness series is brought to you by Therachron, tailoring therapy.
Hey, hello. I'm Dr. Rosy.
Hi, I'm Dr. Krish. We welcome you to the third episode of Season 1 of Therachronicles.
And today, we are going to talk about the different complications of diabetes.
So in our previous episode, we had the opportunity to talk to Dr. Avishkar, where he took us through his journey of being 30 and diabetic. If you missed out on the last episode, do click onto the link in the description below.
So, as we mentioned before, today we are going to discuss about the different complications of diabetes. Now, I'm sure that many of our audiences are unaware of the fact that heart disease is the leading cause of death amongst diabetics.
Not only that, diabetic people are twice as likely to develop heart disease or stroke compared to non-diabetics.
So what happens is that with passing time, excessive sugar damages the blood vessels and nerves which control the heart.
Now here is another quick fact for our listeners. Diabetics are more likely to develop urinary tract infection and bladder problems.
Yes, Krish. Well, talking about urinary tract infection brings me to another dreaded complication of diabetes, diabetic nephropathy or kidney disorder. Now what happens is high blood sugar damages the cells and blood vessels of the kidney that makes it difficult to filter out wastes from the body.
Yes, with time, if diabetes is uncontrolled, then it can lead to chronic kidney disease or CKD, which eventually worsens to result in kidney failure. Now this can lead to requirement of regular dialysis or even kidney transplant.
Now this reminds me of one of my uncles who was suffering from diabetic nephropathy and had to undergo regular dialysis. Well, to say the least, the entire family had to unfortunately suffer both mentally and financially to bear the brunt of the disease.
Yes, that must be very tough. Well, Rosie, as we know, high blood sugar is also incriminated for causing damage to the nerves, that is, neuropathy.
Absolutely. So, in neuropathy, usually the arms and legs develop symptoms ranging from mild numbness to pain. Now, this makes it extremely difficult to perform even normal regular activities. Now, what is very unfortunate is that nearly half of the diabetic people develop nerve problems. And what is even more sad is that not all of them exhibit symptoms.
Yes, actually the longer you have been diabetic, the higher are your chances to develop nerve damage or neuropathy. Diabetic neuropathy can also lead to other issues like digestive system problems, sexual issues in both men and women, and it can lower your ability to feel pain, heat, or cold.
And this may turn out to be a serious problem in itself. You may possibly fail to notice a wound or burn on your foot. The combination of small trivial injuries along with poor blood circulation increases the chance of developing foot ulcers. Now this foot ulcer might get infected. This may necessitate amputation of the limb just to prevent infection from spreading.
You're listening to Therachronicles with Dr. Rosy and Dr. Krish. This health awareness series is brought to you by Therachron, tailoring therapy.
Now coming to diabetes and oral health. I have noticed that people are mostly unaware of the fact that diabetes is mostly connected with dental and gum problems. In my clinical practice, I have often come across patients suffering from gum problems and loose or mobile teeth, and later found out that it is due to diabetes. Apart from this, increased blood sugar levels in the saliva becomes a pool for the oral bacteria, and the bacteria along with food particles from the plaque leads to tooth decay and cavities.
Well, in fact, I have noticed that gum diseases are pretty common in diabetics, isn't it, Krish?
Absolutely. And interestingly, I have seen that treating gum disease can even lower blood sugar over time and reduce the chances of developing complications due to diabetes.
Diabetes also tends to grip on our hearing system. It does so by causing a damage to the small blood vessels and nerves in the inner ear, as a result of which people lose their ability to hear.
Yes, yes. So again, another quick fact.
Please share your quick facts. Your quick facts are generally interesting.
Thank you. Well, diabetic patients are twice more likely to suffer from hearing loss than non-diabetics. Well, now, Rosy, I would want for you to talk about diabetic retinopathy briefly. I mean, of course, you are the expert here.
Well, thank you, Krish. So, diabetic retinopathy is a very common complication. We all have this light sensitive layer at the back of the eyeball, which is called the retina. In diabetics, over time, the small blood vessels in the retina of the eye gets damaged. This leads to development of new blood vessels. Now, these new blood vessels starts to leak, leading to water accumulation in the retina. Now, this eventually leads to visual loss. Well, now, Krish, I too have a quick fact to share.
Oh, please go ahead, share.
Just a small piece of information. Diabetic people are more likely to develop cataracts and glaucoma too.
Okay. Well, you see, when we talk about diabetes and the eyes, we majorly discuss retinal diseases only. So, thank you, Rosie, for sharing the correlation between diabetes and other diseases of the eyes as well.
Well, I'm at least happy to steal your thunder for some time.
Oh, sure, sure. Why should I have all the fun?
So, we now come to a very important aspect of diabetic care. It is imperative to understand that chronic diseases like diabetes takes immense toll on a person's mental health.
Absolutely. And I have seen, living with diabetes not only jeopardizes mental health of the person, but also their family and caregivers at large.
Now, unrecognized and untreated mental health concerns can make diabetes harder to handle and treat. So, it tends to develop a vicious cycle.
So, we had a long conversation about the complications of diabetes. Now, let me give you some good news. And the good news is, all these complications can be prevented or delayed if you are taking adequate self-care.
Now, this will include keeping a check on your ABC. So, if you're wondering what this ABC is all about, then let me tell you A stands for HbA1c, which is a blood test considered as the gold standard for the measurement of long-term blood sugar control. B stands for blood pressure, and C stands for cholesterol.
So, if you're diabetic, keep an eye on your ABC, like Rosie just mentioned. Also, ensure that you are eating healthy, indulging in regular physical activity, being compliant with medicines, cutting down on smoking and alcohol, and of course, undergoing regular checkups.
So, this was a brief about the complications of diabetes. And to find out what doctors have to say about their experience of treating diabetics, watch out for the next episode of Therachronicles, where we will talk with Dr. Niladri Konar. Dr. Niladri is a consultant physician in acute and general medicine in Princess Alexandra Hospital, Harlow. Catch him in the next episode where he will share his insights and experience of treating diabetics.
Thank you for tuning into this episode of Therachronicles. Found it useful? Like, comment, and share it with your friends and family. To keep yourself updated with our latest episodes, subscribe to our channel and press the bell icon. We would love to hear from you at therachroniclespodcast@gmail.com.
The interviews present personal opinions of the guests and are generic in nature. Therachronicles and Therachron does not endorse to the opinions expressed by the guests. We understand that every individual is different and requires customized care. Your doctor knows the best, and the advice, opinions, and suggestions in the interviews are not an alternative to your doctor's opinion. Consult with your personal physician and experts before implementing any changes in your lifestyle, medication, and therapy. Therachronicles or Therachron does not have any endorsements or financial interests with any of the products, medicines, medical equipment, or brands mentioned by the guests in the interviews.